If walking for a few minutes leaves your legs aching, cramping, or unusually tired, you might assume it's simply part of getting older. Sometimes it is, but sometimes recurring symptoms during walking can have another explanation. Reduced blood flow through the arteries of the legs can cause a condition called peripheral artery disease, or PAD. One of the classic patterns is discomfort in the legs that develops with walking or other activity and improves with rest. And when PAD is involved, one simple form of exercise has an important place in treatment. Walking. Not running, not an intense workout, just walking done in a structured way. Research and clinical guidelines support structured exercise as a way to improve walking ability and quality of life in people with PAD. The goal isn't to magically remove an artery blockage. It's to help the person become more capable of walking and doing everyday activities. And that's an important distinction. You don't have to turn every walk into a workout. Moving around your home, walking to the mailbox, shopping, or doing chores all count as physical activity and are valuable. But a planned walking session gives you something different, a specific opportunity to challenge your walking ability and gradually build your tolerance. Think about a typical afternoon. You might walk around the house several times, sit down, get up again, walk to another room, and continue with your day. That's useful movement and you shouldn't dismiss it. But a structured walking session is more deliberate. You set aside time to walk, maintain a comfortable pace, pay attention to how your legs respond, and allow yourself to recover when necessary. The difference isn't that one type of movement is good and the other is bad. It's that planned exercise gives your body a repeated, measurable challenge. And for someone whose walking ability is limited, that distinction can become especially important. There's another reason this matters. If your legs are limiting how far you can walk, the answer isn't necessarily to avoid walking altogether. With appropriate medical guidance, exercise programs for PAD are designed to gradually improve how much walking a person can tolerate. But there's a right way to approach that. Because the moment your legs become uncomfortable, you need to know what that sensation actually means. A little breathing harder than usual, that can simply be part of exercising. Your muscles feeling like they're working, also expected. But recurring cramping or aching in the leg muscles that appears with walking and eases after you stop is a different pattern. It can be a sign worth discussing with a healthcare professional, particularly if it keeps happening. And not every cold foot, tired leg, or episode of weakness means you have PAD. Those symptoms can have many possible causes. So don't diagnose yourself from a YouTube video. If you already have PAD, significant heart or circulation problems, or you're experiencing new or worsening symptoms, talk with your healthcare provider about what level of exercise is appropriate for you. If you find practical, evidence-based health information like this useful, take a moment to like the video and subscribe. Now here's the question that matters for the rest of this video. If you're going to use walking to improve your walking ability, how should you actually do it? Should you simply walk until your legs hurt? Should you stop at the first sign of discomfort? Or is there a more structured way to approach the walk? That's what we're going to look at next. Because the answer isn't simply walk more. It's about understanding how to walk, when to slow down, when to rest, and how to build from there. Picture yourself halfway through a walk. You've been moving at a comfortable pace. You're breathing a little faster, your leg muscles are working, and you can tell you're exercising. That's normal. Then you notice a familiar ache or cramping sensation in your calf or thigh. Should you push through it? Should you stop immediately? Or is there another way to approach the walk? For someone with diagnosed PAD who has been cleared for a structured walking program, the answer can be more specific than either extreme. A structured program may use repeated periods of walking followed by rest. In some programs, the person walks until a moderate level of leg discomfort develops, then rests until the discomfort settles before walking again. But that phrase, moderate discomfort, is important. It is not a universal instruction to exercise into pain. The appropriate intensity and stopping point depend on the person's condition and the walking program they've been given. If you've been diagnosed with PAD, your healthcare professional can help determine whether this approach is appropriate for you. So let's make the distinction practical. If your heart rate rises a little, you're breathing harder, and your muscles feel like they're working, those can be ordinary signs of exercise. If you repeatedly develop the same aching or cramping in your leg muscles after walking for a certain amount of time, and that discomfort improves when you rest, that's a different pattern. In someone with PAD, that pattern can be consistent with exertional leg symptoms and deserves medical discussion if it hasn't already been evaluated. Then there are symptoms you shouldn't simply treat as part of the workout. Sudden or severe symptoms, chest pain, fainting, significant difficulty breathing, or severe dizziness are reasons to stop exercising and seek appropriate medical attention. Other changes, such as new or worsening leg pain, pain occurring even when you're resting, or a wound on the foot or leg that isn't healing, should also be discussed promptly with a healthcare professional rather than handled by simply increasing your walking. The point isn't to become nervous about every sensation in your legs. It's to learn the difference between your body working and your body giving you a reason to get checked. Once that distinction is clear, the walking routine itself becomes much easier to understand. Suppose your healthcare professional has told you that structured walking is appropriate. You start at a manageable pace. You continue while the exercise feels appropriate for you. If the walking program calls for you to stop when a particular level of leg discomfort develops, you rest until you've recovered according to those instructions. Then you walk again. That's the entire basic cycle. There's no prize for eliminating the rest periods. And needing to rest doesn't mean the session has failed. For someone whose walking ability is limited, the objective is to gradually make walking more manageable, not to prove that you can tolerate the most discomfort. This also explains why a planned walking session isn't necessarily the same thing as simply being active throughout the day. Daily movement is valuable. Getting up from a chair, walking around your home, doing errands, and moving through your normal routine all contribute to physical activity. A structured session adds something different, a repeatable challenge that you can monitor and gradually adjust. That repeatability matters because you can actually notice changes. Maybe the same walk feels easier. Maybe you can go a little longer before your symptoms appear. Maybe you recover more quickly. Those are much more meaningful measures than simply saying, "I exercised today." And there's an important psychological benefit to thinking about walking this way. You don't have to start by asking, "Can I walk for 30 minutes?" Start with a question you can answer. What can I safely and consistently do today? That gives you somewhere to begin without turning exercise into a test of willpower. If walking is appropriate for you, consistency is likely to be far more useful than one heroic session followed by several days of inactivity. So remember the three answers from the beginning. Don't blindly push through significant or concerning pain. Don't confuse normal exercise effort with a medical warning sign. And if you have PAD and are an appropriate candidate for exercise, a structured walking program can provide a way to repeatedly challenge your walking ability while allowing recovery. The fascinating question is what happens inside the body when you repeat that process. Because the goal isn't simply to make you tougher at tolerating discomfort. Something deeper can change in the way your muscles and circulation work together during exercise. And that's where this simple walk starts becoming much more interesting. So how can walking become easier if the artery itself hasn't simply been cleared? Think of it this way. Imagine a town where one of the main roads has become narrower. Traffic can still get through, but when demand increases, that road has a harder time handling everything. Now imagine that the town becomes better at working with the roads it has. The main road hasn't suddenly become wide again, but with practice and adaptation, the system can become better at handling the same basic situation. That's a useful way to think about what exercise can accomplish in PAD. The narrowed artery remains part of the problem, but repeated walking challenges your legs to work with the blood and oxygen available to them. Over time, exercise can improve walking performance and functional ability, even though that doesn't mean the underlying arterial narrowing has simply disappeared. So the goal isn't necessarily to make the artery look normal. The goal is to improve what your legs can actually do. And this is where the benefit becomes much easier to recognize. Imagine that today you can walk for 5 minutes before your leg symptoms limit you. With an appropriate, consistent walking program, you may eventually be able to walk farther before reaching that same limitation, or handle the same distance more comfortably. The artery didn't have to be magically unclogged for your walking ability to improve. Your walking capacity changed. That's the distinction I want you to remember. Because for someone dealing with PAD, improved walking capacity isn't just an exercise statistic. It can affect everyday life. It might mean walking through a grocery store with fewer interruptions. It might mean getting from the parking lot to a doctor's office without needing to stop as often. It might mean moving around your home with less difficulty. And those changes matter because the ability to move through ordinary life is closely connected to independence and quality of life. This is also why progress shouldn't be judged only by how hard a workout feels. If you're gradually able to walk farther, tolerate activity better, or handle an everyday task that previously limited you, those are meaningful changes. But more isn't automatically better. You don't need to turn a manageable walking routine into an endurance challenge. And if your symptoms suddenly become different, significantly worse, or begin occurring at rest, don't respond by simply increasing the intensity. That's a reason to speak with your healthcare provider. It's also important to keep the terminology straight. People often use the phrase poor circulation to describe almost any problem involving their legs, but that phrase is broad. PAD is a specific medical condition involving narrowed or blocked arteries that reduce blood flow to the limbs. So when we're talking about the evidence for structured walking in this video, we're talking specifically about people with PAD or circulation-related walking limitations that have been medically evaluated, not claiming that walking is a universal treatment for every cause of cold, tired, painful, or weak legs. And walking doesn't replace the rest of PAD care. If you've been diagnosed with PAD, your treatment plan may involve addressing cardiovascular risk factors, taking prescribed medications, and making other changes recommended by your healthcare professional. Exercise fits into that bigger picture. So when you hear that walking may help with poor leg circulation, think about the claim accurately. It doesn't mean one exercise can repair every narrowed artery. It means that, for appropriate people, structured walking can help improve walking performance and everyday function despite the limitations caused by PAD. And that may be more valuable than it sounds, because you're not training simply to become better at exercising. You're training to make everyday movement less limiting. So if walking is appropriate for you, how do you turn everything we've discussed into a routine you can actually maintain? There isn't one perfect number of minutes that everyone should walk. Your starting point depends on your current walking ability, symptoms, overall health, and whether you're following a supervised program or exercising at home. So don't begin by asking, how much should I be able to walk? Ask a simpler question. What's the next manageable step? Maybe that's establishing a regular walking time. Maybe it's gradually increasing the amount you're able to walk. Or maybe it's becoming more consistent with the amount you can already tolerate. The exact progression should fit your situation. And don't compare your distance with someone else's. If another person can comfortably walk several miles while you can manage much less, that doesn't tell you whether you're making progress. Your most useful comparison is with your own starting point. Progress also isn't always perfectly linear. Some days will feel easier. Other days may be harder because of sleep, whether illness, stress, or simply how you're feeling that day. One difficult walk doesn't erase your progress. Look at the pattern over time. Are you gradually able to walk farther? Is the same activity becoming more manageable? Are everyday activities becoming less limiting? Those changes matter. And remember, structured walking is one part of the bigger picture. It doesn't replace medical care, and it doesn't mean a narrowed artery has simply been cleared. If you've been diagnosed with PAD, follow the exercise guidance appropriate for your health and discuss your routine with your healthcare provider. If you haven't been evaluated but repeatedly experience leg aching or cramping during walking that improves with rest, don't assume it's simply aging. Bring that pattern to your healthcare provider. And if you experience severe or sudden symptoms, chest pain, fainting, significant difficulty breathing, or another symptom that feels like an emergency, stop exercising and seek appropriate medical attention. Exercise and medical care aren't competing choices. The goal is to use appropriate exercise alongside the care your health requires. So here's the simple takeaway. If walking is safe and appropriate for you, make it a regular practice, not a one-day challenge. Start where you are. Take the next manageable step. Give your body time to adapt and judge your progress over weeks and months rather than one difficult afternoon. Because the real goal isn't walking a certain number of miles. It's being able to do more of the things that make everyday life yours. Getting to the car, walking through the grocery store, moving around your home, or getting out to see the people you care about. Sometimes protecting that freedom starts with something remarkably simple. Taking the next safe step. If this video helped you understand your legs a little better, consider liking the video and subscribing for more evidence-based information about healthy aging and staying independent. And I'd like to know, when you walk, have you ever noticed leg aching or cramping that improves after you rest? Share your experience in the comments without trying to diagnose yourself from the symptoms. Your experience may help someone else realize they should talk with their healthcare provider. Thank you for spending these minutes with me. Take care of yourself, keep moving in ways that are appropriate for you, and remember that small, consistent actions can support the freedom to keep doing the things you value.